I'm Aline, certified fertility awareness educator, and in this episode, I'll be interviewing Laura Cascardi, a certified herbalist and founder of the Equinox Center of Herbal Studies in Fort Collins, Colorado. This is an herbal education center and apothecary that focuses on integrating new science and ancient wisdom. Welcome, Laura. Thanks so much for being
Hi.
here.
Yeah, thanks for having me. How fun.
And today we're going to be talking about shocker, the menstrual cycle, and more specifically, menstrual blood. Welcome to Cycle Wisdom Chats, where we dive into the world of fertility awareness, hormonal health, and our womb's wisdom. From an herbalism perspective, what do you look for when you're like assessing someone's menstrual blood?
I'm looking for bright red blood with very little clots. So even in the very beginning and at the very end, the blood color should really be bright red with no mucus or no
Okay.
clots. Yeah.
Okay. And what about like the texture of it? Are we seeing like really stringy? Are we seeing like thick? Like, do you have any more descriptors for texture?
Yeah, as far as texture goes, like it shouldn't be stringy, like pull it out. It should be like almost like a smooth, like glob. If you do things like free bleed, you should be able to like literally bleed out like a beautiful like blob of blood. It won't be a clot.
And for those who don't know what free bleeding is, I'll mention so free bleeding is bleeding without having anything that's collecting your blood.
I will say it's a really beautiful experience to be able to free bleed because it gets you really intensely in tune with what your body's doing. So what happens is almost a sensation like almost as if you need to urinate, even though we know it's coming out of a different location. And then you just go to the bathroom or go to the ground if it's warm enough. And the blood will just come out of your body quite cleanly. You can wipe, but you won't need to wipe in the same way as if you're wearing a pad or a cup. The consistency shouldn't have any stringiness to it at all. It should almost be
Mhm.
like a liquid, a fluid.
I think what is a misconception too is that when you're bleeding, you're like constantly bleeding. But
Right.
in
No.
actuality, the uterus, the womb will contract, and that might be where you feel like some pressure or tension in your lower abdominal region. And then what you'll notice is that sensation, almost like it feels like you're peeing, but it's coming from your out of your cervix, down your vaginal canal, and out of your vaginal opening. If this isn't somebody's lived experience, they're not experiencing blood like this, what are some other indicators of needing support? Or like if they're seeing a certain color of blood, do you have any recommendations on what that can mean or what type of support somebody would access?
Yeah, totally. So if you're seeing brown blood, it indicates that there's stagnation. The brown blood means that like that blood has been sitting there. It's not properly oxidized. So this can happen for a number of reasons. One reason is you may have a tilted cervix or uterus. So it's always really good to find a womb practitioner who knows how to either tell if you're twisted or uh, give you tools to untwist it. So that's one reason you can have brown blood. If you can imagine it pools in there. The other reason that we might have brown blood is that sometimes our flow may not be going as fast because we have stagnation. And pelvic stagnation is fairly common. It happens a lot with people who have more cold constitutions. They get sick a little bit longer. They have autoimmune issues. They're the people who, it's 70 degrees and they're still putting on sweaters and kind of cold still, right? That just effort, that cold essence. And so herbs that can really help with that are things like cinnamon. I really like ocotillo. I really love calendula and Damiana for those things also. And I may choose, as an herbalist, I may choose different herbs to work with that depending on other symptom pictures. So, for
Okay,
example, if the person is really got a sluggish cardiovascular system, I'm going to go ahead and choose cinnamon, right? That's going to warm their system up and improve the overall flow of their cardiovascular system. It's
gotcha.
always
Okay.
so important to remember that we're a whole body, right? So if we have one thing happening in our body, it's going to throw these other places off. And
Mhm.
the quality of our blood, not as much the quantity, but the quality of our blood really tells us a lot about how the rest of the blood is actually behaving. Right. And so we
Mm.
use different herbs depending on what the overall symptom picture of the individual is to remove that stagnation.
That's fascinating. Just I never really thought that the menstrual blood could be a diagnostic tool for how the blood is moving in other areas of the body.
Yeah.
Yeah.
Yeah. Absolutely. It can tell us so much, right? Like it's really cool. If you see like mucus, that tells us that are problems in the lymphatic system. So, like,
Okay.
that's one that I might use something like cleavers or chickweed to really get that lymphatic system activated. So if we start seeing clots, we also have to think about stagnation. But we also might look at what our diet is like, right?
Mhm.
Like, are we actually bringing in things that are stagnating us throughout the menstrual cycle? So, like foods that are having issue or that we're having problems like absorbing. Do we have too many solutes in our blood, making things go slow? The first place, and one of the reasons that we can see these problems happen in our reproductive organs is because the first place that starts hurting is the places where we reproduce, right? Like if we're living in a toxic state within our body, first thing that's going to go is our reproductive system, right?
Yeah.
Because like that's like it's not like it's absolutely functional. Don't get me wrong, and I'm not trying
Not
to
a
like put
necessity.
yeah, right? Like we need our digestive system, we need our urinary system. And so what happens is our body is like, well, let's give less oxygen to, right,
Mm.
which is like when we say nutrients, let's give less oxygen to our reproductive system and give that oxygen to other cells, since we're oxygen starved, right? We may even see this with like smoking tobacco, right? You
Mm.
may even see in the color of your moon blood, it may be like almost like a dark maroon color because there's less oxygen available for your reproductive system.
My next questions are about quantity. And so if
Mhm.
somebody is experiencing like not a lot of blood at all or having pretty like extreme amounts of blood during their menses and it's not related to like perimenopause, which sometimes that flooding can happen during perimenopause, do you have thoughts on quantity of menstrual blood as well?
Yeah, and everybody's a little different in this department. Sometimes, when somebody's missing, their moon flow, that's called amenorrhea. Amenorrhea means total absence, but sometimes you'll have such light menstrual flows, that it's actually not really releasing that lining, and that is something to consider. That's where some of my favorite herbs there can be, either angelica, and that's Angelica archangelica, calendula, and damiana are some of my
Okay.
favorites. Those also all fall into the category of a memnagogue, which is like when you kind of jumpstart. They're not abortifacients; they don't cause abortions, but what they do is they like jumpstart, and they do this by kind of gently removing that stagnation. I do want to mention another herb there is ocotillo. That is another one of my favorites for that kind of hey, we need to get this moving. On the flip side, when we see that flooding, some of my favorites are actually shepherd's purse and yarrow. Both of
Okay.
those will actually pull back on the excess. It's normal to have heavy bleeding on day 1 or day 2, but if it starts going into day 3 or 4 with heavy bleeding, that starts being too much, right? And really, again, like, if there's heavy bleeding and it's, like, more than your personal usual, something else might be going on systematically. It's always good to ask bigger questions.
What are your thoughts about heavy bleeding as it relates to iron deficiency? And
Mm.
are there any herbs that you recommend for building our blood?
Well, one of my absolute favorites is yellow dock.
Mm,
Yellow dock is
okay.
such a beautiful herb to make iron more bioavailable. It's one of those herbs that is completely sustainable, so you don't have to worry about like over harvesting or overusing. It's also even safe during pregnancy,
Wow.
even though it is also a gentle laxative. It's not a heavy laxative; it's a gentle, but you can use it. It's one of the few laxatives you can use during pregnancy also, so
Another herb that's become very, very popular is Vitex or
mhm,
chaste tree, and I'm
mhm.
curious to get your perspectives on utilizing that because I feel like it's gotten a lot of people have been talking about it as it relates to perimenopause, and
Mm.
also supporting luteal phase length.
Vitex really works well for the menstrual cycle. It works really nicely. It almost acts adaptogenic to the reproductive system, like almost like whatever a
Oh.
person needs. I see all of our veins, right? Which remember is closely related to it. Just recently left that family, which still means that it has characteristics that are similar. Vitex is also a nervine. Right,
Mm,
so it actually relaxes the body, relaxes that, like, stress, that constant fight or fight. So when you're, like, taking it regularly, you're
mhm,
also regulating your nervous system, which kinda goes back into that idea that our emotions and our stress plays a huge role in how we present in our lunar cycle. It does these other physiological pieces. I really believe that a lot of it has to do with the nervine properties of Vitex, over
mm,
anything else. Just another note on Vitex, it's also called chaseberry, right? Or
mhm,
some people call it monk's pepper. Um, it's in the herbal world thought of as an aphrodisiac.
mhm,
Um, but what I have found, and this is another little cute thing about Vitex, is that in men, it actually really does act as an aphrodisiac. So there are really times when men need it, but we'll put men aside for a second. In women, what I find is because of the nervine properties, it has a tendency to relax women and allow them to actually increase their libido, especially once again, if it's stress that's causing them to not have that. Right.
mm.
So it's got that interesting double side to it.
Yeah, many benefits. What is your recommendation for somebody who wants to start exploring working with herbs?
This can be a tricky one because not everybody has access to an herbalist, right? Like
Mhm,
it's a little bit hard. So, but I do recommend if you have one around to connect with an herbalist because um, having somebody else look at your situation is so much more effective than trying to overanalyze. And having a guide to do that is really nice. In saying that, that's not always available. One thing I would say is be careful about our TikTok herbalists and our Instagram herbalists and things of that nature. Look at our matriarchs, Rosemary Gladstar, Susan Weed, Aviva Rom, looking at our herbalists who are actually practicing, really doing this work and getting the word out there. Another really good herbalist who is one of our matriarchs is Feather Jones, right? She's amazing too. Having a few tricks up your sleeve for self-care is great, but it's always important to remember that like herbs do work, and looking at, like, are you on any pharmaceuticals, right? And do those pharmaceuticals interact with the herb that you're taking? And
Mhm.
I'm sure you've mentioned some of these, but St. John's wort will interfere with birth control, right?
Mhm.
Like, so you have to be really careful about, the herbs that you're picking. Coupled with that, you have to keep in consideration what kind of allergies you have. So
Mm.
what works for one person may not work for another. And that's where constitutional herbalism comes in, and even like organ-based constitutionalism.
Herbs are medicine, and they can be very potent. And so
Mhm.
not there's just needs to be a level of discernment and a level of awareness before we start putting anything in our body, really. Well, if you are getting value from this video, please let us know by liking, subscribing, or commenting below. I would love, Laura, for you to share just any additional offerings that you have. I'd love you to chat a little bit more about your school and how people can stay in contact with you.
One of the things that Equinox Center does is we are working on trying to create equity in herbalism. So we offer a lot of free classes for the public. We invite people to come in to our shop and have sit down and have a cup of tea. We have a huge reading library. If you just want to like access books but not have to buy them, you can just sit and drink tea and read. My apothecary is a brick and mortar, and then, like I said, I do consultations, and I have a school here. It's a 10-month program that starts every March, called Foundations in Herbalism. So if you're really ready to do the deep dive, this is where our big program comes in. We've been doing it for 11 years now. My school is 11
Wow.
years old. Yeah, it's
Wow,
really really
congratulations.
exciting. Yeah, thank you. And we cover everything. We do deep materia medica, anatomy and physiology, nutrition. We do medicine making, spiritual based classes, and all sorts of other things in between. And it's 10 months. We meet 2 days a week, one intensive weekend a month.
If somebody's not located in Fort Collins and they want to consult with you, you do offer virtual consultations for people.
Yeah, absolutely.
Amazing. And I will put all of those links in the description notes so you can check out Laura's school. And if you're ever in Fort Collins, Colorado, go by and grab a cup of tea and, yeah, connect with community. Thank you so much for what you do and how you support your community. And I'm just filled with gratitude for knowing you and knowing that you exist and have the wisdom
Oh.
that you're sharing with all of us. So thanks for being here with me.